Hello everyone. Today, we're exploring the medication glycopyrrolate, commonly known by its brand names Robinul and Cuvposa. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Glycopyrrolate, known by its brand names Robinul and Cuvposa, is an anticholinergic medication. It's primarily used to reduce salivary, tracheobronchial, and pharyngeal secretions in various medical conditions. It functions by blocking the activity of acetylcholine, a neurotransmitter that influences muscle contractions and secretions in the body. This drug was approved by the FDA and is often used in preoperative settings to reduce salivation, manage peptic ulcers, and treat chronic severe drooling in patients aged 3 to 16 years with neurologic conditions. Additionally, glycopyrrolate can be prescribed to manage symptoms of chronic obstructive pulmonary disease, COPD, by helping to relax the airway muscles, making breathing easier. Warnings: Glycopyrrolate has its set of precautions. It should not be used in patients with certain medical conditions such as glaucoma, myasthenia gravis, obstructive uropathy, obstructive gastrointestinal tract diseases, severe ulcerative colitis, paralytic ileus, toxic megacolon, or in patients with a hypersensitivity to glycopyrrolate. Patients should be monitored for signs of anticholinergic toxicity, which can include symptoms like dry mouth, blurred vision, tachycardia, urinary retention, and constipation. Before taking this medicine. Before starting glycopyrrolate, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. Patients with kidney or liver disease, heart conditions, high blood pressure, or thyroid disorders should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring is advised for those using glycopyrrolate long-term to manage side effects and ensure safety. You should not take glycopyrrolate if you have a history of severe constipation, blockage of the stomach or intestines, or if you are unable to urinate. It's also important to inform your doctor if you have ever had a heart condition such as congestive heart failure, coronary artery disease, or if you have experienced a recent heart attack. Before starting the medication, inform your doctor if you have ever had autonomic neuropathy, hiatal hernia, gastroesophageal reflux disease, GERD, kidney stones, or if you are on any other medication that can cause a decrease in gastrointestinal motility. It's also essential to let your healthcare provider know if you are prone to heat prostration, which can occur in high temperatures and during physical activity, as glycopyrrolate can decrease sweating. Side effects: All medications can have side effects, and glycopyrrolate is no exception. Common side effects include dry mouth, blurred vision, constipation, urinary retention, and drowsiness. Some individuals might also experience dizziness or headache. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, glycopyrrolate can cause more severe side effects such as confusion, hallucinations, rapid heartbeat, difficulty urinating, or decreased sweating leading to heat stroke. If you notice any signs of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical attention immediately. Furthermore, glycopyrrolate may cause complications in patients with certain medical conditions. It's important to monitor for any signs of gastrointestinal blockage or severe constipation. If you experience significant abdominal pain, vomiting, or any signs of an obstructive condition, contact your healthcare provider promptly. Interactions: Glycopyrrolate might interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Notably, interactions may occur with other anticholinergic drugs, medications for Parkinson's disease, certain antihistamines, and medications that can slow down gastrointestinal motility. Dosage: Correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking glycopyrrolate. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The dosage of glycopyrrolate varies based on the condition being treated. For reducing salivation in preoperative settings, the typical dose for adults is 0.004 mg per kilogram administered 30 to 60 minutes before anesthesia. For managing peptic ulcers, the usual dose ranges from 1 mg to 2 mg taken 2 to 3 times daily. For treating chronic severe drooling in children aged 3 to 16 years, the dose is typically 0.02 mg per kilogram, given 3 times daily. It's important to note that dosing may need to be adjusted for elderly patients or those with renal or hepatic impairment. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on glycopyrrolate, it's advisable to stay hydrated and avoid overheating, as the drug can decrease sweating and increase the risk of heat stroke. Given the potential for dizziness and blurred vision, it's wise to avoid driving or operating heavy machinery until you know how the medication affects you. Additionally, alcohol should be consumed with caution, as it can exacerbate certain side effects. FAQ. Many wonder about the age restrictions for glycopyrrolate. Currently, its safety and effectiveness for chronic severe drooling are established for children aged 3 to 16 years. However, for other uses, it's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of glycopyrrolate. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.